Hi, this is Dr. Wallis. Welcome to the Anatomy and Physiology series on the blood. Today we'll be doing part 3, which focuses on blood types as well as blood transfusion compatibility. In order to understand blood types, we have to know a little bit about surface antigens. Surface antigens are glycoproteins that stick out of the cell's surface that identify the cells to the immune system. They're literally like little ID cards that tell the immune system whether the cell is a self cell and whether that cell is healthy or not. The immune system travels around the body and monitors all of these antigens. All of the normal, healthy self cells are ignored, and foreign cells or infected cells are attacked by the immune system. Our blood types are genetically determined, and they're displayed by the presence or absence of specific surface antigens on the surface of our red blood cells. Our red blood cells can have any combination of the following surface antigens. We can have surface antigens A, B, as well as surface antigen Rh. We'll start by introducing the 4 basic blood types, and then in a couple slides we'll make it a little bit more confusing. The 4 basic blood types are blood type A, B, AB, and O. Again, which blood type you are is determined by which surface antigens you have on the surface of your red blood cells. So which identifiers you have sticking out on the surface of your red blood cells. If you're blood type A, that means that your red blood cells have the surface antigen A, and only A. They do not have B present. If you're blood type B, that means that your red blood cells have surface antigen B present. Blood type AB has both surface antigens, A and B. And blood type O has neither. So type O blood does not have antigen A or antigen B present. Now your blood contains antibodies that are pre-programmed to attack any antigen type that you do not have present on your red blood cells. In other words, your immune system is primed to attack anything that is not self. So if you have type A blood, your blood has antibodies that are programmed against the type B surface antigen. If you have type B blood, your blood contains type A antibodies, or anti-A antibodies that will attack the A antigen. Type O blood has both A and B antibodies, and type AB blood has neither. Let's take a look at why this is. We just mentioned that if you have type A blood, your red blood cells will have the surface antigen A sticking out on their surface. That means that your blood will have antibodies that are anti-B. You have antibodies that are programmed to attack B because B is not self. Your body knows that all of your red blood cells should have A antigen only, and if they come in contact with a B antigen, they're going to attack it. This antibody will attack that B antigen because it is not self. If you have type B blood, your red blood cells have the B antigen. And that means that your blood has antibodies that are anti-A. They're programmed to attack A because A is not self. If you have type AB blood, that means that your red blood cells have antigens A and B. Both antigen types are present because you have AB blood. That means that your blood does not have antibodies against A or B. Okay? If your blood had antibodies that were programmed against A, they would come meet up with this antigen and they would attack themselves. And you don't ever want to be attacking your own red blood cells. So people with AB blood do not have antigens against A or B. Finally, type O blood. Type O blood, remember we said, does not have surface antigen A or B. Okay, it's lacking both of those. However, the blood does have antibodies against both A and B. Okay, so if you have type O blood, you have antibodies that will attack A and B because neither one of those is self. Now, those are the basic blood types. Now we're going to take a second to kind of complicate it a little bit, and that's with our third antigen type, which is the Rh factor or Rh antigen. The Rh factor is named Rh because it was first discovered in the rhesus monkey, okay? Hence the Rh. Everybody's blood type is either Rh positive or Rh negative. Rh positive simply means that you have the Rh antigen on your red blood cells. If you have this Rh antigen present or this identifier present on your red blood cells, your blood will never have Rh antibodies. Again, you don't want to attack yourself. If you have Rh negative blood, that means that your red blood cells do not have the Rh surface antigen. You're Rh negative. You don't have that antigen. Now, this blood will only have anti-Rh antibodies if the blood's been exposed to the Rh antigen. Notice that this is a big difference when we're talking about the Rh antibodies and the A and B antibodies. Okay, you're automatically born with antibodies against A or antibodies against B if that's not your blood type. But when you're born, if you're Rh negative, your body has no idea that that Rh antigen even exists, so you don't have antibodies against it. Again, you have to have some sort of exposure. This happens when an Rh negative woman gives birth to an Rh positive baby. This also happens if we have a transfusion occur and the blood types are not compatible. Okay, if you give an Rh negative person blood that's Rh positive, then they have exposure to that Rh antigen, and at that point, their blood will start making antibodies against that antigen. So agglutination just refers to a clumping of the blood. An agglutination can happen whenever an antigen and antibody meet up. So we have these antigens on the surface of our red blood cells, and we can call these antigens, or we can say that these antigens are agglutinogens. These antigens are continuously screened by the immune system to ensure that they're safe. Our immune system's checking all of these antigens on the red blood cells to make sure that the red blood cells are in fact our red blood cells. If the plasma antibody meets up with its specific antigen, so if an anti-A antibody meets up with its A antigen, then the antibody will attack that antigen and agglutinate or clump with the foreign antigens. Hey, this can be extremely harmful if it happens in a patient because the clumping of the blood will cause the blood to hemolyze or rupture those red blood cells. However, we can use the fact that the antigens and antibodies agglutinate or clump in order to perform blood typing tests to see what blood type a patient is. Again, we said that when the antibody and antigen meet up with each other, that can cause the blood to agglutinate or clump, and that can be dangerous because then the red blood cells will hemolyze or rupture. So we want to prevent this from happening. We want to make sure that we're only transfusing a patient with a blood type that's compatible with their blood type. Notice we say that when we're doing transfusions, the blood types must be compatible. We don't say that they must match exactly. And we'll talk about different compatible blood types in a couple slides and how we can figure out what blood types are compatible. We test for transfusion compatibility on both the donor, the person who's giving the blood, and the recipient, the person who's getting the blood, again to make sure that they'll be compatible so that we don't have any cross reactions occurring and so that the red blood cells don't hemolyze or rupture. If we don't know the blood types or we don't have a compatible blood type available, type O negative is the universal donor. That means that type O negative blood can be given to any other blood type. Here we'll see an example of how we can test for blood type. What you're looking at here is 3 different troughs. So you have a trough here where you put a drop of blood, you put a drop of the same kind of blood here, and a drop of the same kind of blood right here. And then what we're going to do is we're going to put antibodies against A here in this one. We'll put antibodies against B here in this one. And we'll put anti-D, which is the same thing as anti-RH, here in this trough. And what we're trying to figure out is when we put these antibodies in, are they going to find their antigen and clump or agglutinate? If we put anti-A here in this spot, and those antibodies find an antigen and clump, that means that we must have an A antigen present in the blood type. Hey, so looking at this is showing us a clumping here in the center. So the antibody found its antigen, and these red blood cells must have A present on them. So we know that we at least have an A antigen present. Here in this anti-B spot, we added antibodies against the B antigen. We don't have any clumping occurring here in this spot. So we know that we did not have a B antigen present on the red blood cells. The B antibody never found its matching antigen, so it didn't cause any clumping. Here in the anti-RH spot, we added antibodies against RH. Here we see clumping occurring here. Because that clumping occurred, we know that this RH antibody met up with its matching antigen. So the red blood cells must have RH as well. So if we have red blood cells present that have A antigen and RH antigen, that means that this blood type must be A positive. The A because of the A antigen, the positive because it was positive for the RH factor or RH antigen. Now we do the same thing here. We have another blood type, and we're trying to test to see what that blood type is. So we put a drop of blood in each of these troughs, and then we're going to put our respective antibodies in each one. So here we put antibodies against A, and this did not show any clumping, so we don't have any A antigens present. Here we put antibodies against B, and you see that there is some clumping present here. So that means that the B antibody found its B antigen. So these red blood cells must have a B antigen present. Here we put anti-RH. The RH antibody met up with its antigen, and you see this clumping that's occurring. So that means that the red blood cells must also have RH antigens present. So this is what our red blood cell looks like. It has B antigens and RH antigens. That means that the blood type is B positive. Again, we did the same thing here. We put blood in each trough, and then we add our antibodies. We have clumping here in A, so that means we must have A antigens. We have clumping in B, so we must have B antigens. And we have clumping in RH, so we must also have RH antigens. That means that our blood type is A, B positive. Finally, on the last one here, again, we put a drop of blood in each trough, and then we add the respective antibodies. We added anti-A antibodies here. There was no clumping that occurred, so we don't have any A antigens. We added anti-B antibodies here. No clumping occurred, so we don't have any B antigens. Finally, we added anti-RH antibodies here. No clumping occurred, so we don't have RH. That means that our red blood cells look like this. They don't have any of the antigens present on their surface. And that means that the blood type is O negative. It's O because it does not have A or B present, and it's negative because it's RH negative. It does not have the RH antigen present. We'll finish up with a discussion on blood transfusions, and we'll go through numerous examples so that you can see what blood types could donate to who and what blood types can receive from which blood types. One thing that it's important to remember is that when we're talking about blood transfusions, we're only transfusing the red blood cells. So if somebody with A positive blood is giving blood to another person, they're only giving those red blood cells with the A and RH antigens. They're not giving their antibodies that they have in their bloodstream as well. Okay, let's go through a few examples. So we'll start out over here by talking about O negative blood. If you have O negative blood, remember that your red blood cells have no antigens, right? They don't have A or B. That's what makes this O. And it's negative, so it's negative for RH. That person's blood does have antibodies against A, antibodies against B, and antibodies against RH. So first let's talk about O negative blood. What different blood types could O negative blood donate blood to? Who could they give blood to? Let's look at all of our different blood types here and see. Again, remember that when we're giving blood, we're only giving these red blood cells, so we don't really care about these antibodies right now. Let's look at A positive blood. If someone has A positive blood, their red blood cells have surface antigen A and surface antigen Rh. And their blood has antibodies against B because B is not self. So let's see, if we took this blood cell right here and put it into this blood, would we have a problem? No, right? This antibody against B would not find its surface antigen. There are no surface antigens present, so the antibody isn't going to have a problem at all. So yes, we could give the blood, O negative blood, to A positive blood. Let's look at A negative blood. A negative blood has surface antigen A only, and its blood has antibodies against B, and we're going to go ahead and assume that it's been sensitized so that it has antibodies against Rh. So if we put this O negative blood cell in A negative blood, would we have a problem? No, right? The Rh antibody isn't going to find its antigen. The B antibody is not going to find its antigen. Not a problem. So we know that we could also donate to A negative blood. Let's look at B positive. B positive blood has the B surface antigen and the Rh surface antigen. And it has antibodies against A. So if we put that O negative red blood cell here, would we have a problem? No. This antibody is not going to find an antigen. There are no antigens present on O negative blood. Okay, so essentially you could do the same example over and over for the rest of these blood types, and what you would find is that O negative blood can donate blood to any blood type. Okay, because of that, we say that O negative blood is the universal donor. Okay, the red blood cells don't have any antigens, so we can give them to any of these blood types and we will not have a problem. Now, let's take a second and look at what blood types O negative can receive blood from. So we said that O negative blood looks like this, right? The red blood cells don't have any surface antigens, so we're going to say that the blood has antibodies against everything. We have anti-A antibodies, anti-B antibodies, and again, we're going to assume that the blood's been sensitized and it has anti-Rh antibodies. So let's look at all these blood types. A positive blood, those red blood cells have A antigens and Rh antigens. If we put these red blood cells into this blood, would we have a problem? Absolutely. The Rh antibodies would meet up with this antigen, and the anti-A antibodies would meet up with their antigen. They would attack these red blood cells that we just transfused, and they would cause them to rupture and hemolyze and cause reactions to occur in the bloodstream. So we cannot give A positive blood to O negative. Could we give A negative? Let's see. A negative blood has the A surface antigen only. But again, we've got these A antibodies here that would come and attack those red blood cells. So we can't give A negative. B positive has B and Rh antigens. This B antibody would meet up with the antigen and attack the red blood cell. So would the Rh. So we can't give B positive. And if you continue through these examples, you'll see that we can't give B negative. We can't give AB positive because of the A, B, and Rh antigens. We can't give AB negative because of the A and B antigens. Okay, so let's look at O positive. O positive blood does not have A or B, but it's positive. So that means it is positive for this Rh antigen. So if I put this red blood cell in this blood right here, these Rh antibodies would attack the Rh. Okay, so we would still have a problem with O positive. No O positive. That means that the only blood type we can give to a patient with O negative blood is O negative. Okay, so I could give Here we go. This blood right here, I could give red blood cells that look like this, right? The O negative red blood cells don't have A, they don't have B, they don't have RH. So these antibodies aren't going to meet up with any of their antigens, and we're not going to have a problem at all. Okay, so that means the only blood that O negative can get blood from or receive blood from would be O negative blood. Okay, so they can give to anyone, but they can only receive from O negative. Let's take a second and look at AB positive blood. If we look at AB positive blood, you'll remember that the red blood cells have surface antigen A, surface antigen B, and surface antigen RH. That means that their blood does not have antibodies against any of these. Okay, so they don't have any antibodies present. Now, when we look at who AB positive blood can give blood to, okay, let's look at, say, A positive. So somebody with A positive blood, remember, has A and RH antigens. That means that they have antibodies against B. So if we put this red blood cell here in this blood, we would have a problem, right? This B antibody would find its B antigen and it would clump or agglutinate. So we can't give it to A positive. Same thing with A negative, right? A negative blood has the A antigen. It does not have this RH, but it still has the A antigen. And that means that the blood has anti-B antibodies and anti-RH antibodies. So if we put this red blood cell in this blood, again, this anti-B antibody would find its antigen, the RH would as well, and we would clump. So we can't give AB positive blood to A negative. Let's look at B positive. B positive blood, remember, has B and RH antigens, and the blood has antibodies against A. So if we put this red blood cell in this blood, we would have a problem. Okay, the anti-A antibodies would meet up with their A antigen and would clump or hemolyze. So we can't do B positive. We also can't do B negative. Okay, because B negative doesn't have this RH, but it still has these antibodies against A. Let's take a look at AB positive blood. AB positive blood has A, B, and RH antigens and no antibodies. So we could put this blood cell into this blood and we wouldn't have any problem whatsoever. Okay, notice that these blood types match. Okay, AB positive and AB positive. You can always donate to self. So let's look at AB negative. AB negative blood has A and B, and it has antibodies against RH. So we could not put this red blood cell into this blood because the RH antibodies would attack the RH and would hemolyze or rupture. If you guys continue this out with O positive and this should be negative, and O negative blood, you'll see that you would have a problem with both of these as well, right? O negative and O positive blood don't have the surface antigens for A or B. So they're going to have antibodies against A and antibodies against B. Those antibodies would obviously find their antigens here on this red blood cell and would clump or hemolyze. So the only blood type that AB positive can be given to is AB positive. Now, who can AB positive blood receive blood from? Let's look. When we look over here at AB positive blood, again, remember that it has all antigen types present, but it does not have any antibodies present in the blood because it does not want to attack self. So let's look at what we could do for A positive. A positive blood, remember, has A and RH antigens. So if we put this red blood cell in this blood, would we have a problem? No, there's no antibodies, so it doesn't matter what antigens we have, we're not going to attack them. So yes, we could do A positive. A negative blood, remember, just has A. We could put that red blood cell in, there's no antibodies, so it's not going to attack it. We could put, how about B positive? Has B antigen and Rh antigens. We could put this blood type in. There's no antibodies, so they're not going to attack. So we could put any of these blood types in. Okay? AB positive blood can receive blood from any blood type because their blood does not have any antibodies present, so they're not going to attack any antigen. Because of that, we call AB positive blood the universal recipient. They can receive blood from anyone. So O negative is the universal donor. They can give to anyone. AB positive is the universal recipient. They can receive from anyone. Let's do one more example. Let's look at B negative blood. B negative blood has red blood cells that have B surface antigens. They have blood that has antibodies against A and antibodies against Rh. So let's look at these different blood types and see who we think that they could give to. Okay, so let's look at A positive. A positive blood has A antigens and it has Rh antigens, and the blood has antibodies against B. So if we put this red blood cell right here into this blood, this B antibody would find its B antigen and would clump. So we can't do A positive. Same thing with A negative. Hey, A negative blood does not have this Rh present, hey, but it still has these B antibodies present. So the B antibodies would meet up with their B antigen and would clump. Let's look at B positive blood. B positive blood has B and Rh antigens, and it has antibodies against A. So if we put this red blood cell here, would we have a problem? No, right? The only antibody we have is A, and that A antibody is not going to find its antigen. So B positive is good. We could give B negative blood to B positive blood. Let's look at B negative blood. B negative blood has B antigens only, and it has anti-Rh and anti-A antibodies. Okay, we could give that B negative blood because the Rh and A antibodies would not find their corresponding antigen. So we can also give B negative blood. Let's look at AB positive and AB negative. AB positive blood has A antigens, B antigens, and Rh antigens. So the blood does not have antibodies against anything. Okay? So we could put this blood cell into this blood and we would not have a problem. There are no antibodies to attack this B. AB negative blood has A and B, no Rh, so we can assume sensitization and say that there's an Rh antibody. But we could still put these B negative blood cells in and we wouldn't have a problem because there's no antibody present here that would attack this B. So AB negative is also okay. Let's look at O negative blood. O negative blood, O positive. O positive blood has the Rh antigen only, and the blood has anti-A and anti-B antibodies. That means that we cannot put these red blood cells with the B antigen into this O positive blood because the antibody right here would meet up with this antigen and cause it to clump. Let's look at this last one, which should be O negative. O negative blood does not have any antigens present, but it has antibodies against A, antibodies against B, and antibodies against Rh. So again, if I put this red blood cell over here that has the B antigen into this blood, these B antibodies would clump with it. So we can't do O negative either. So B negative blood can be given to B positive and B negative, AB positive and AB negative. So who can B negative blood receive blood from? Let's clean this up a little bit. B negative blood has just B antigens, it has anti-RH and anti-A. So could B negative blood get blood from A positive? Let's see. If we put red blood cells that had A and RH, these antibodies that are present would attack and we would have a problem. So no A positive. If we put A negative, we put red blood cells that had just A. These antibodies that are present would attack and we would have a problem. So no A negative. What about B positive blood? If we put B positive blood, we have B antigens and RH antigens. Okay, the B would be okay, but we have antibodies against RH, so that would attack. We cannot give B positive blood. B negative. B negative blood just has the B antigen. So if I gave this red blood cell to this blood, I would be perfectly fine, right? And they match. You can always get from your same exact donor. So B negative can get from B negative. Let's look at AB. AB positive blood has surface antigens A, B, and RH. So if I put this red blood cell in this blood, the antibodies against A would attack and the antibodies against RH would attack. So no AB positive. AB negative blood still has surface antigens A and B. So if I put that red blood cell in, this A antibody would attack. So no AB positive or negative. Finally, let's look at O positive and O negative. O positive blood has only RH antigen present, but that would still be a problem. Okay, we have this RH antibody here that would attack it. Okay, so no O positive. This one here, which again should be O negative. O negative blood, remember, does not have any antigens present on its surface. Okay, so we could put this red blood cell into this blood and it would be perfectly fine. The A antibody does not find its antigen and the RH antibody does not find its antigen. Okay, so B negative blood can receive blood from B negative and from O negative. Thank you for watching. If you have any questions, please post them in the comment section.